On the COVID watch tonight, unfortunately still more bad news than good. But since this is Christmas Eve, let's start off being half full here. First, a quick happy birthday to Dr. Anthony Fauci. He turns 80 today. Fauci, he told kids he's already vaccinated Santa as one of the first wave of people to get the COVID vaccination. Santa and Fauci, they're in good company. CDC says so far 1 million Americans have been vaccinated for COVID. But the goal was to vaccinate 20 million by the end of the year, a goal they certainly are going to fall far short of. Here is where the news gets even worse, though. Americans are setting record highs for air travel this week, at least since the pandemic first hit. And they're doing that with the risk of spreading the disease as hospitals report record highs in COVID cases. The spread now happening so fast in so many places that the University of Washington is now estimating that 567,000 American COVID deaths we could have by April, even as more and more people are vaccinated. So the question begs, how and why so many? The answer is because right now only about 3/4 of Americans regularly wear masks while out in public. If that mask wearing rate had rose, let's say to 95% like in other countries, we could save 49,000 American lives. Those stats, the sobering backdrop for one of the biggest inoculation efforts in American history. But the question is, how will the government get the vaccines from Pfizer and Moderna to you and your doctors? What about the role of those massive pharmacy chains who are struggling and supposed to be helping out? For those answers, let's bring in Lori Freeman. Lori, she's the Chief Executive Officer of the National Association of County and City Health Officials. I'm really trying not to be a downer on the eve of Christmas, but I'm looking at some of the projections for where we may be as a country in February, and I got to tell you, I'm going back. I spoke to John Barry, who wrote the definitive book about the 1918, influenza, and he said to me about a year ago, maybe a little less, but he said, some of the same markers are there to now, and I never would have guessed we could be looking at the fatalities. We could be looking at in a few months from now where we already are, but where we could be going. But that's a trajectory that I'm imagining a lot of the folks that you're speaking to on the ground dealing with this, that they're worried what the next 60, 90 days holds for us.
Absolutely. And we really have to push forward, get this vaccine into communities, overcome some of the hesitation and worry and mis and disinformation about the vaccine, and really turn the corner on getting people vaccinated quickly. But at the same time, the vaccination is not the full solution. We still have to do our mitigation efforts to prevent the spread in the meantime.
Even if we get the vaccine to as many people as we can come springtime, the amount of lives it'll save will be, tangible, but it'll be a fraction of if we can get people to keep their masks on and to mitigate. Literally, I think most people would think it's the opposite way. The vaccine will save way more lives here the next 90, 120 days, but it's really just doing what we should have been doing here for the better part of 6 to 9 months.
That's right. That's right. And we all need to take our personal responsibility in this. It's going to help us all. It's going to help your loved ones. It's going to help us end this pandemic.
What goes through your mind when you see pictures right now of airports with tons of travelers getting ready to get loaded in? Because I speak to health officials and they say, we just start looking at the clock. We're wondering what 2 to 3 weeks is going to come through our ERs or ICUs. It's unfortunately, potentially that simple, right?
Potentially, yes. And we've learned a lot just from Thanksgiving. We're learning it right at this moment. So if we can do nothing else, let's look at what's going on around us in terms of this mass resurgence of the disease across the country, presumably a lot of it from Thanksgiving activity. And let's not repeat it again a few weeks from now.
It's great news between Pfizer, Moderna, and more coming on board with the vaccine. Give me the part that we still have a challenge ahead of us. Is it that a lot of areas of this country are not the same? They don't have the same storage capacity, especially for the vaccines that need to be stored at really cold temperatures with limited shelf lives. Is it that we're relying on the CVS's and the Walgreens to be basically the point of contact, that this isn't really nationalized. 50 states have 50 plans. What's the stuff that the folks that you talk to keep them up at night about getting this vaccine, which is a great thing, into as many arms as soon as possible?
Well, in these early stages, the quantities just aren't going to be able to cover even the priority groups identified. And it's important to know that there has to be prioritization within the prioritization groups. And our local health departments at that local level are very well aware of how to communicate and educate the members of their communities about this. But there's going to be some very tough decisions that have to be made in the next several weeks about who gets priority within the priority groups and how that's being done.
I'm curious, Lori, because you deal with folks at the county, at the city level. I saw in Florida, for example, the Governor DeSantis is not prioritizing frontline workers here to be vaccinated, while almost every other state is. Would you guys prefer that the discretion be left up to 50 different governors, or would you rather the federal government say, no, listen, this is what we're going to do. Frontline workers, we got seniors, you got the nursing homes, or whatever the right order is. I'm not equipped to decide that, but that it's one size fits all for everyone, or do people want to have the local control to decide stuff at the risk of, creating division?
There needs to be local control over it to some extent, because even within these priority groups across the country, community by community, the distribution looks different in terms of the number of people over 75 years old, the number of frontline essential workers. The number of people in each of these groups varies significantly, community by community. And so that's why that local control is ultimately important, and that local engagement with the public health system is really crucial and critical. However, the guidance that's issued by the CDC helps to provide some overarching guidelines that help us to further delineate within those priority groups. And so both of them are, both of the national, federal level guidance and the local decision authority is going to be important hand in hand in getting these into the hands of the right people.
Obviously, getting people to have faith in this, even though it was an expedited process, I haven't heard one health or scientific official say that they cut corners on the safety of it. But to get people to believe in it, we got to have a massive educational campaign in this country with all officials, regardless of political party, to roll up their sleeves. And also, I would think, to make sure people don't think people are cutting in line, as you alluded to. How important is it that the president roll up his sleeve too, so that a lot of his base is skeptical, and also you have the anti-vaxxer crowd that doesn't follow a single political party. But what would you like to see happen to make your guys' jobs easier if we're going to get 75, 80% of the people to get this, so we do get that herd immunity?
Well, we have some good news from some research that we just completed with some other partners this week that show that 39% of the public is sort of in a wait and see mode. They're on the fence about the vaccine. There's only really about 10% of people that are hardcore anti-vaccine that will not get the vaccine. But within that 39%, we have an opportunity to engage openly, be transparent, share information, address any questions or concerns that those folks have, and get them over to the other side, the side of the people that are ready to take the vaccine. So there's opportunity to overcome it, but we do need leadership showing both demonstrating their own commitment to this vaccine, but also sharing information openly.
Lori, I appreciate the time, and have a safe and happy holidays.
Same to you. Thanks so much.
And up next, we focus on Georgia ahead of the January 5th runoffs to determine the control of the Senate. We're going to take you inside a Democratic rally to see what Georgians are saying, plus the very latest on turnout and early voting numbers, next on RFL.